Go ahead.
Hi, my name is Tessa,
And my name is Tegan.
and our policy presentation is on vaccination regulation in the United States.
So first we're going to dive into some background. The first known vaccination was done by a doctor by the name of Edward Jenner in 1796. But the first known vaccination, or vaccine, was made in 1885 for the rabies virus. This creation and updation of vaccines has created a term, preventable diseases. Preventable diseases are prior contagious diseases that were easily spread in a population. But now, after the creation of vaccines, we can control and minimize these symptoms.
So the question we pose is, should the federal government require that children be vaccinated against preventable diseases? We will reference back to this throughout the presentation.
So first we're going to kind of dive into the First Amendment, where a lot of anti-vaccination groups are finding their ground. So a lot of anti-vaccination groups are finding their tread in the Free Establishment Clause and the Free Exercise Clause, where the government states that it will be neutral and religiously accommodating, as well as we constitutionally give parents the right to choose whether or not to give their child vaccinations. So who gets exemptions? What allows you to be exempt from nationally enforced government policies? So some current qualifications if you were to request an exemption from vaccines religiously is states often choose one of these three different qualifications. One, that parents must be part of a nationally, locally, or state recognized religion that opposes vaccination. Or parents must demonstrate a sincere and true belief that they should not vaccinate their child for religious reasons. Parents must simply sign a statement saying that they would like to be religiously opposed to vaccinations and not give their child a vaccination.
This is a quote from Dr. Seth Berkley, who is the CEO of Gavi, which is a vaccine alliance. He says, "With infectious disease without vaccines, there is no safety in numbers." This plays into our next topic of herd immunity.
What is herd immunity? Herd immunity is when a population is vaccinated and is being able to be protected from multiple strains of a specific virus by stopping the source microorganism from infecting the large population. So kind of an example about how herd immunity works. Take the measles virus. For the measles virus to be eradicated, you need to have a population that is 90 to 95% vaccinated. By vaccinating your public, you are able to destroy the different strands of that disease, and it stops it from spreading to those who are already vaccinated for a certain strand. But if a population is only, let's say, 80% vaccinated, it will still pass to those who are vaccinated, as that the different types of that strain of that disease will still pass to those people.
Moving on from herd immunity, we're going to talk about some key cases in the vaccination debate. The first of many being in 1902 in the city of Cambridge, Massachusetts. Jacobson versus Massachusetts was a U.S. Supreme Court case in which they ruled that it was constitutionally sound that the people of the town get vaccinated against smallpox because of the outbreak that happened in the town. Next is the vaccine autism controversy. We're actually going to dedicate the entire next slide to that because it is a big platform for the modern anti-vax movement. And then 2015 was the Phillips versus City of New York case, in which the state of New York was constitutionally allowed to require that children to get vaccinated against all preventable diseases in order to go to public school because it is federally funded. There, of course, are the exemptions of medical and religious philosophies. So first we have Vaccines and Autism, which was a study done by Andrew Wakefield in 1997, published in 1998. He claimed that the MMR vaccine was the main cause of autism in British children. Some lasting effects of this study are that measles, which was eradicated in 2000, after his study was published, the vaccine rates dropped incredibly low, so much so that the measles virus resurfaced in 2013. Some of the other lasting effects are celebrity anti-vax campaigns, which we will talk about later, and the higher rates of children not being vaccinated. So there are two sides to this political campaign, which is against or anti and pro-vax. Some of the main literature that you will find is that vaccines cause autism, even though it was found to be a falsified study and was discredited. Vaccines are unsafe because they contain trace amounts of mercury and formaldehyde. which doctors have proven that it won't actually harm you. And then a big platform that has given an anti-vax movement is social media. And some celebrities also chime in and they support it, and that's how a lot of citizens then in turn support it. And then we also, going back in time, find Reverend Edmund Massey, who led one of the first charges on the anti-vax movement in 1772. The other side is the pro-vax side, in which we talk about why requirement would be a good thing. Firstly, the vaccinations are proven effective, 95% at most and 85% at least, depending on the individual. Then we talk about how it eradicates preventable diseases like measles. Then you also find that the vaccine preventable diseases are expensive. They add up to a $10 billion industry. And then it protects those who can't get vaccinated due to medical or religious reasons, such as what we talked about with herd immunity.
So we have two political comments to talk to you guys about. In the first one, you see that the anti-vax woman is taking down the syringes which are representing the vaccine protection that vaccines offer the public, thus releasing the preventable disease monster onto the public. We also have a banned comic over here, which are actually viruses of the measles. And what they're saying is thanks to the anti-vaxxers for making this comeback possible, because measles were eradicated and then later came back.
So vaccination debate has been covered in media and news outlets for over 2 decades, and since the resurgence of measles, it has become a headliner. These are some personal testimonies from Ethan Lindenberger, a student who got vaccinated after doing medical research after he was not raised to be a vaccinated person. Diane McGowan, who lost her son to the influenza virus, once he was not vaccinated. And then Brittany Cara, who was a mother who quoted the Bible and said that she was not going to get her children vaccinated because she, quote, believes that believing in vaccinations is a mental disorder, unquote. And that caused a lot of backlash in the social media community. And as we can see, both sides do attack each other, so much so that it's hard to find the real issue. This slide represents our public opinion when we rephrase the question, should the U.S. government require that children be vaccinated against preventable diseases? And 69% of Americans said yes. There is a 2% independent gap in which people say it should be regulated by state, and that's currently what the law is. It is regulated by state. But during our research, we also found that there is no particular bias depending on party or depending on each side, except for each side thinking that they are correct. Then we also find that there is some bias in the medical and religious exemption because the people or the courts do not want to impede on the First Amendment.
So what is currently being done? What are the programs we have in place for vaccinations? Universal purchase. As of 2015, 9 states have universal purchase, where a student or child who is not insured may still receive the vaccination. We also have insurance requirements. The ACA requires that insurances have protections for preventable diseases. These preventable diseases and services specifically include immunization. What are some strengths and weaknesses of these policies, though? Strengths is that children who are not insured or cannot afford immunizations are able to get them. Some weaknesses, though, are students who are still immune-compromised